The end of open enrollment for Medicare is quickly coming up, and that can make the major decisions facing seniors and other people who are enrolled seem more pressing. That is why George Young is here to tell us why open enrollment is so important. George, you're the perfect person to turn to.
Thank you. Thanks for having me. Well, open enrollment is important because it's the one opportunity that anyone eligible for Medicare gets to make choices on their health care for going into the new year. For instance, open enrollment actually starts October 15th, runs through December 7th. And so you have a chance to look at everything. So maybe your financial conditions have changed or your health status has changed. So you want to look at all the things that happen as far as your health plan. Is your doctor still on that plan? Do you still have the same hospitals available? What about your prescriptions? Are they still available? And what tiered levels are they? And what are the copays and out-of-pocket maximums of that particular plan? Because each and everybody's financial condition may change in a given year.
All right, George, I'm going to be honest. It can be a little confusing. All of the information that's coming in, everything you need to check, you know, doctors, prescriptions, what's covered, what's not covered. How do we kind of make this easier?
There's a lot of resources out there. Yeah. For instance, if you really want to go to the Medicare site, you can go to Medicare.gov and take a look at the plan finder and see what's available in your particular zip code. Or if you want to look at some of the UnitedHealthcare plans, go to uhcmedicareplans.com. Or if you just want to learn more about Medicare in general, go to MedicareMadeClear.com.
Now, I've also heard this Medicare Advantage. I've kind of heard it thrown around a lot. I know it's kind of becoming more popular. Why do you think it's becoming so popular, and really what is it?
So what we've had over the last 5 years is about a 50% increase in enrollment in Medicare Advantage plans, while the Medicare eligible population has grown around 18%. A lot of that is just due to convenience, because Medicare Advantage plans tend to have kind of an all-in-one or one-stop shop. You get all the parts of Medicare, parts A, B, and D, in one particular health plan. They tend to offer a little bit more benefits than original Medicare. So a lot of people find the convenience factor, and if you're really looking for vision or dental or things like that, some of those plans have those available. So that's why I think a lot of the reasons we've seen a lot of growth in Medicare Advantage.
Well, and that's exactly why I kind of sit down with you, because maybe some people have heard of that. They've heard other people saying they're on board with it, but it all boils down to everybody is an individual and has individual needs. So the best thing to do is to kind of go over what's out there, see what fits you like a puzzle piece. And one of those things that can kind of be confusing, I want to kind of clarify with you today, as I know there's like a Part A, a Part B, a Part C. You know, people kind of see that. Is there an easy way to kind of explain what that is?
Sure, I'll do my best.
Yeah.
Medicare can be very confusing if you are not familiar with it. So Medicare has several parts to it. Part A covers hospitalization.
Okay.
Part B covers preventative and your physician visits. Part C of Medicare is where the Medicare Advantage plans come in. We contract with Medicare to provide health care coverage. And then Part D is the pharmacy part. Okay. And so what a lot of Part C plans or Medicare Advantage plans do is they combine A, B, and D into one plan. And kind of, as I said earlier, one-stop shop. Makes it a little bit easier for the person, that Medicare enrollee who's eligible for Medicare, so they can really look at all the options without having to go through maybe a plan for Part D and a plan for Part A and B.
So we were kind of seeing them up there. That helps a lot, I think, kind of breaking it down, letting you know what each means. Maybe you need, like you said, an all-in one-stop shop plan. Sometimes, you know, something is just personal what you might need, and I know we're kind of looking through these. So really, if you're kind of going through everything, like you said, things have changed in your life, or even the plans themselves have changed, or there's something new that might be better for you, the best thing to do is to get some information, maybe talk to somebody and see what's best. That would be square one, right?
That is square one.
Yeah.
And really look, things change year over year with the Medicare Advantage plans and maybe your health conditions. There's a lot of resources out there. We even have a Medicare store at the Crossroads Festival Shopping Center. And you can feel free to stop by and really ask questions and really find out more about Medicare from some of the folks that staff that center.
Yeah, because getting, the information is really not the hard part. Because look at all these different resources that we have available, people you can reach out to, get more of a clarification. And I'm sure you hear plenty of personal stories from people of, coming to get some help and that are so grateful at the end of the day.
I really do. And in a lot of cases in some of our plans around the country, the one big thing we hear is that a lot of people think of health care or insurance coverage. It's just, for when I'm sick and I'll go to the doctor.
Yeah.
But we really focus on some of the preventative care. We've had some examples of people going in for preventative care. They found out certain conditions about their health that they otherwise would not have found out about. And we were able to assist them in getting treatment for that through either our house calls programs or some of the other programs we offer.
Well, George, that's exactly why you come to visit us, is because you think of everything, you give us that great information, and you know exactly how that helps everybody personally. So I want to thank you for coming. I know I'm going to give everybody some of that information we gave earlier one more time, but I wanted to thank you.
Thank you.
Now, Medicare Open Enrollment is taking place now until December 7th. For more information, call 1-800-997-2234, TTY 711, or log on to uhcmedicareplans.com.